There is nothing which is wrong with the country that a new government cannot fix. It is time for a new start, a fresh beginning, new direction, people-centered leadership. That's why Team Unity Dominica introduces the Clean Slate, a new political direction for the current political era. The Clean Slate, an idea built on new and progressive energies based on what is best for Dominica and Dominicans. The Clean Slate, the platform for a new and progressive political coalition. The Clean Slate, uniting the partisan colors with a message of renewal and hope.
Good evening, everybody. A special good evening to everyone, and welcome to another Team Unity, the Clean Slate program. I am your host, Carlos. I'm here with my co-host, Mrs. Petra Cameron George, and tonight we will be doing part 2 of our People's Health, the nation's wealth. Part 2 we started last week with our dear nurse, Sister Christine Duffy from the lovely village of Benz. That's part of the Calabishi constituency, Calabishi, Pebush, and so on. She's a very qualified person in the field. But before we go on, Petra, how are you doing?
Good night, Brother Carlos. Nice to see you this evening.
Yes, I am well. How's your week been going so far?
My week have been okay. I couldn't ask for a better week. What about you?
I've been working hard, trying my best to be as much involved in the aspects of our island's politics. Even as recently, well, you hear in the background some music from the guy Mr. Ridge, featuring the great Chubby out of the Midnight Groovers. That's his little spin on the Anita song in a booyah flavor with a little bit of the independent style. I mean, we're now in the independent season, and I had to make sure that we not forget that we're doing we another year of independence in Dominica. We need to remember 3rd November, and the day that Dominica became independent. And the time that we should set aside all differences and come together, celebrate what is truly Dominican. What would you say to that, Petra? I mean, there's so many events.
Yeah. I used to enjoy my independence season in Dominica. I used to be in all the cultural dances. Obviously, I was not dancing, but I was following the Capuchin cultural group wherever they go. So we used to be Granby, Portsmouth, wherever they went, that's where I was. I was a supporter.
My cousin used to be a member of the, well, I should say she is a long-standing member of the Capuchin cultural group. And she used to dance all over the island. I remember Gaffer on all cultural galas. She's always there.
Yeah, definitely. She was one of the, yes, she and her sister. Right. I guess she's missing it too, because nobody at dance cultural, they really don't not miss it. That was the cultural group from the States. They try to have their own cultural group in the States. That's how much they meet our culture. So
Right. We know that there's the TV Village Creole coming up. That I think that's the replacement for the previous staple, the Creole in the Park. There's so many events. Some events at the Ram, some special the Watto. You know what Watto is?
Nope, I have no idea.
Watto is an event. Watto Dominica, an event they have at Rosalie Bay Resort, where they cook food or in the local styles, the one pots,
Oh,
this steam, yes, and this chef, I forgot her name, but she loves, she puts on that even, she's been putting on for a couple of years, and persons come on to, I think she has foreign chefs coming in as well, making a contribution to that event. And of course, the Independence Book World put on by the Jamaican Dominican Danger Dane and the Swinging Stars Dance and the World Creole Music Festival, 3 nights of pulsating rhythms. And not
yes.
forgetting the important part of the Independence Day itself, the National Day Parade, where the Prime Minister will give the speech. We look forward to hear what he has to tell us. Hopefully, it's some message of renewal and hope. If not,
Yeah,
community will be.
I think
Community,
they also have some activities in the Portsmouth area as
yes,
well.
yes,
I
they
think they
do.
have market day with a difference. They have some prize giving. I heard the young lady said on Saturday. So they're asking everybody to come and support the local vendors, buy from them, win prizes and so. So I think Portsmouth have some activities as well. I'm not so sure if Town Council. I think I saw on Facebook that Portsmouth Town Council have an activity with somebody else. So those in the north, if you want to enjoy your independence, check out the people of the north and see what they have, and let us all enjoy our independence. That's what we have. That's what will make us Dominica. So
Not
let us.
forgetting, not forgetting the Creole in the North, which will
Oh
be
yeah.
held, in, I think, in about a week or so.
What is the date for the Creole in the north? I
I
didn't hear so much about it.
I can't remember the date. I saw it being advertised today, but it's happening sometime probably in a week or so.
Okay, well that's nice. That's nice. Enjoy. Shake a leg for me. Shake a leg for me.
I'll get some pictures for you too. I, I,
Yeah.
I can't have the crab and so on, but I guess you'll be missing that.
Listen, I stopped eat crab a long time, brother Carlos. I stopped eating crab when I figure out that crab have too much work for that little piece of meat inside of it. I was like, mm-mm. So I only eat crab backs, and somebody have to make it already, and I just enjoy it. But I'm not eating the crab. Too much work.
By the way, that's it on independence. We can't forget to touch on independence, and right now we got to move on to the meat of the matter, and that is our clean slate agenda. The clean slate community introduces the clean slate, the new political conversation for Dominica. Out with the old, in with the new, and we're focusing right now. This is part two of the people's health, our nation's wealth. And we got to reintroduce our dear sister, Christine Dupuy. Nurse Chris, how are you?
Good
Hi, good
night.
night. Good night, everyone.
Welcome
I
back.
am well. You can't skip the cultural event too fast, man. You're leaving me out of that. This is the
I
time.
know, right?
This this is the time I really miss being in Dominica, man. You walk around and you bounce up on friends you haven't seen for so long, family and the food and the activity and everything. The only thing, honestly, I never well, I used to get in a lot of problem is when is to wear the madras dress, because for some reason I never like it. I always feel hot. So whenever my mother used to make it, and man, when time to wear that, it was always a problem for me. But everything else, I really miss being in Dominica that time. I remember in school, man, the marching in the hot sun. Jesus.
I know.
Oh,
Oh Lord. I
yes.
love marching though. I enjoy especially when we go Roseau and they have to give us the bun. Yeah.
Mm.
I love that bun.
And your malt.
And the
Yes.
malt after. Yes.
Yes.
I used to enjoy it, but
I
man, the
enjoy
sun and
marching in the hot sun. It
the
was so much
speeches were
fun.
too long, man. Too
I
long.
know,
You
right?
forget the
It's
children
so
in the
good.
hot sun, but
But
Oh,
right now things are different. You're not allowed to stand for the entire duration of the speeches. The
oh,
students are
oh.
allowed to sit in the stadium. So in
okay.
terms of that, people fainting and so on, we don't have that anymore.
It's
And
less
then
now.
afterwards they come back
That's good.
and get ready
Okay,
for the
well that's
match.
good.
Yeah, that's good because before you standing in that hot sun for two,
Oh
three
yes,
hours.
I did it. I did it for a couple of years. Did it for the Dominica Grammar School, and I did it for the college.
Mm, okay. All right. Well, it's a pleasure to be back here with you guys. How everybody doing?
We
Well, we're
good.
doing good. We're doing good.
Lovely. All right. So shout out to all our Dominican fellows wherever they are. We hope they enjoy the festive season. Enjoy the dance and everything. The what you call the dance, the special dance,
The quadri-
And the quadrille
quadrille and heel and toe and everything.
and mazouk and waltz. Yes.
All right.
Yeah, well,
Okay.
Carlos not a cultural dancer. He might more catch me in the what's his name? The Swinging Stars one at Fort Young.
Oh,
I might go and dance there,
Okay.
but was a strong might.
Hmm.
um, anyways,
So
we
I
last week.
yeah, sorry.
So last week we didn't get very far on the matter. We didn't even touch on the TUD.
but before we go into the matter, we forgot to hail up our princess. Princess
Oh,
Eva, and wish her happy independence. Brother
thank you.
Carlos, we have to wish our
We
Princess
can't,
Eva
we
happy
can't,
independence.
we cannot forget Eva. Thank you for that picture. Thank you for that. We wish her very well as she continues her studies. Um, I trust that she's doing well as she usually does in school, and she's enjoying her time. We have to make some time to visit the school in the not too distant future to see how everybody's doing. I know the principal is looking forward to engaging us on different levels. Of course, see how our dear little Eva is doing.
Yep.
I hope that she's doing well in the season, and of course, her family, her parents, and extended family as well. Hope everybody's doing good, and we do hope that everybody continues to support her as she strives to be the person that she can be. And of course, I may have omitted to do that, but I have to give a special good evening to our members, our other members who are looking. Of course, our fans, our supporters, both here and abroad. Uh,
Yes.
those who will come on board in the future, those who are looking, make sure that we're on the right track, make sure that we're not a fly by night and enterprise. Team Unity is all about seriousness of Dominica's progress, get us on the footing that we are supposed to be, get us to do what we want, what Dominicans have been asking for, what we're striving for, and what we want to. Petra, you there?
Definitely, definitely. And so let's just encourage our public to just reach out to us if you're interested in joining the Clean Slate program. Reach out to Brother Carlos or myself on Facebook. You can message us directly and tell us how you want to see our country move forward, because we're going to work with everybody. We're not going to exclude anybody because we're all for country. And we just want to make sure that our country become wealthy. And as we go into it with our sister tonight, we'll understand that if we stay healthy, we can become wealthy. And so we're going to turn over to Sister Chris. Let her just give us a recap on what we did last week Tuesday, and so that we could take it out from there.
Right. So last week Tuesday we spoke a lot about improving access to healthcare for in the more undeserved or remote population, our rural areas, so to speak. And we emphasize on promoting preventative health practices and reducing the burden on the hospital, or as we say, decentralizing healthcare. We also spoke about strengthening our early detection and management of diseases that would lead to better health outcomes. Tonight, however, we're going to speak a little bit on the a policy that Team Unity it would like to implement once we get into government. And so we believe that good health is the most important factor of a country's progress. Therefore, Team Unity is launching the Healthy Dominica agenda, and that agenda focuses primarily on promoting health, and that's from birth all the way through senior care. So from birth to geriatric, pediatric to geriatric. And the approach would be more on preventing and treating illnesses as much as possible. We aim to care for the whole person, not just the health conditions, starting from bringing Dominica primary health care initiative back to how it was in the 1980s. So our goal is to work with people in Dominica, individuals, families, organization, villages, parishes, health district, churches, the Kalinago territory, different towns, Portsmouth, Roseau. And what we will do is encourage what our mission would focus on, a love yourself kind of mission. And that would be where persons will take responsibility for their own health and help build a healthy nation. Because if each one of us focus on our well-being, then that in turn will trickle down to the entire Dominica population on a whole. You know, our goal as well is to work with. Well, let me ask a question though. Is we know that weed, what we call ganja, um, I know a lot of persons believe in the health benefits of the marijuana, but we know it's not legal in Dominica. I know in some Caribbean countries, though, they give persons permission to use it as medicine. Is that been done in back home? Anything you know about that, Carlos?
I don't think that it's been fully utilized for its medicinal purposes. However, the government, prior to the last general election, they they encourage the usage of it, though not in a structured manner.
Oh,
So,
okay.
so, so persons are allowed to plant, I think, fruit trees.
3 trees.
Yes, so persons are allowed to
Okay.
plant fruit trees legally, and the police will not arrest them. So,
Okay.
however, from a TUD standpoint, we not straying away too much from the health. We will put the the the, the marijuana in a so should I rephrase that? Cannabis. We would take care of it in a more structured manner. We will deal with it proactively. We will look at the medicinal purposes and not just that. There are so many properties that it can be used for. The oil is good for persons who suffering various illnesses. I can attest to that from certain family members. I may not want to go into detail, but yes, I can attest to that of its medicinal purposes, even with pain. So yes,
That's perfect.
it is possible, and under a community government, all those things will be looked at in a more structured manner. It is possible to make it's a multi-million dollar industry.
Hmm.
And if it's done properly, it can bring revenue to the country, and not just to the country on a whole, but to the people in the country.
Right. Because that's why we will be learning from different groups like the herbalists and the rastas who believe a lot in those health natural
Remedies.
remedies,
Yes,
Yeah.
including the cannabis, how it can be utilized in a safe manner, you know, to
Yeah.
assist with certain illnesses. They can learn from us, we can learn from them, because we know there are some persons who are Rastafarians on a whole who do not believe in the tradition in our medicine.
Yeah.
They don't take the vaccines. Their kids are not allowed to take vaccines. They don't take the tablets and them things. So they believe in their herbal medicine. So we will learn from them. Um, Pharmaceutical experts, medical professionals, health organizations, and different regions around the world. So these are some of the policies that Team Unity will implement going forward as we aim to make Dominica a more healthier nation. As we said, our approach is about preventing and curing illnesses, or treating, not just treating the symptoms, but helping to alleviate some of the symptoms that are there. But in order for us to do that, just how last week we spoke a lot on strengthening our public health and equipping our facilities with everything that they need properly, we cannot do it without the staffing.
Right.
And we understand as healthcare professionals, or any employee, as a matter of fact, doesn't matter where you work, in order for to get the work done, our staff has to feel motivated.
That's right.
Motivated employees is the key, or employees are the key to if an efficient operation and maintaining the quality of any business place, including the health. And in our healthcare system is where you find some of the most demotivated staff.
As a matter of fact, Chris, the staff turnover, I dare say, is maybe as high as
Pretty high.
some of those supermarkets in internationally, say, or even a McDonald's. So
Oh,
the people come there, the nurses, for example, come there, they get trained, and they move on.
They move on.
Right. So
Yeah.
we have to look at ways of getting our health professionals to not only stay, but those that have moved on, find ways to make the thing attractive, so that they may want to come back. But nobody really wants to leave their home.
I know.
Exactly.
Nobody,
Exactly.
nobody really wants to. If you leave your home, it's
Exactly.
because things are so bad. You have no choice.
You
You
don't
don't.
Or
have
you
a
get opportunities that you will not want to turn down because you don't have the opportunities back at your home.
Right.
right.
So we have to look at creating the kind of opportunities that persons will be attracted to coming back home and working in the health sector. Those who used to work there, and those who left and found other work to do because they don't want to continue in it anymore, and so on and so forth.
So one of our plan though is to, well, TUD plan, as it relates to health, is a return and retain of our healthcare professionals.
Yeah.
And we can do that in different ways. One of the most important reason why a lot of our healthcare workers leave is because, one, the compensation. If my skill and the amount of work that I do doesn't match the pay that I take home at the end of the month, you know, that already is a factor to leave. And when they go, they find the payment from the outside places are a bit high. Although if you look at it, the cost of living in some of the places might be a little high, but
Yeah.
the pay is still better than what we get, or what we can say, the compensation. Let's just, instead of saying pay.
Yeah,
So,
and the benefits.
and the
And the
benefits.
benefit, and
Right.
also sending back money home. Most of the people who work in the US, because the US is like almost is 267 easy, they find
Mhm.
it's better that they can better take care of their family, because if they send 100 US, the family have $267.
Exactly.
So they better take care of their family base, even if rent over there is expensive. but they feel to themselves they can take care of their families back home better by being outside.
Right. So that's why our plan would include improving the working conditions for our healthcare staff, ensuring that there's professional growth within our healthcare system, and having proper staff incentives.
Yes.
You understand, right? Good. Now, we have to, first of all, offer compensation packages that can, I don't want to use the word compete, but it's better than what persons getting outside. Because as I said, that is one of the reasons why persons leave. When you look at our compensation package in Dominica as opposed to somewhere like Antigua, it's not much of a big difference. But when you look at places like the US and Canada and England that has been sucking our healthcare workers like over the last couple of years, especially right after the COVID 19,
Yeah.
we had a mass migration of healthcare workers to these places because the compensation package that they were offering was had
So no.
to turn down. You
Yeah.
know, when they offer you housing, free housing for a year or a couple months, 45 to 50 US dollars per hour. You understand? We have to be able to match that.
Yeah.
Um,
So now I can tell you from personal knowledge, I have family and close friends migrated from Dominica and are still in the health sector, having
mhm,
left Dominica, being in the health sector. Not just nurses,
mhm.
doctors as well.
Right, definitely. So when I talk about healthcare, we're not just talking about nurses, we're
Nurses
talking about our
also.
lab technicians, our x-ray
Right,
technicians,
right.
our
Exactly.
doctors, our specialists, where different areas within the healthcare system.
I have a
Because nurses
classmate.
alone cannot function.
I have a
I
classmate
know.
from my high school time who used to work at the what was the Princess Margaret Hospital, left and migrated, and is now living internationally. And he used to be working in the labs. So now we lose trained persons, qualified persons
Yeah.
Mhm.
in those sectors, and now we have to go train. Not that we have problems training more people, but we need to be able to retain the people who are trained
Or
in the
trained, exactly.
right.
Exactly. Because now it's like we just training people to leave.
Exactly. We like a
There's
training
a term
school.
for that, but I can't come to mind right now. You know.
It's a
Well,
brain
I
drain.
cannot speak on that.
Yeah,
I
say
cannot
that
speak on
again.
it.
It's a brain drain.
Yeah.
Exactly. You're training persons because let me tell you something. The US, they happy to get Caribbean nurses, because when they get one Caribbean healthcare professional, a nurse, a doctor, whatever, that person is well rounded.
That's right.
In those places, you have um, a nurse to do phlebotomy, to stick a patient. Then you're taking care of one patient. You need must have 5 or 6 different nurses
Yes,
to
yes,
do different things on that one patient. To suture, you need a suture specialist. You need a phlebotomist. You need
yes.
different things. You understand? When you
In
get one
Dominica,
nurse from the Caribbean, we do everything:
yes.
catheterization, suture, everything. We are trained and skilled properly to do that. So when they get us, it's like an asset to them.
Mhm.
You
Yes,
understand?
definitely. And
And
our,
they will do,
they are our human assets, actually. They are our human assets. So we
and
train our human assets to go be other assets to other countries and improve their
exactly.
sector. And then it's just crazy. But I know in time, when they see the program and they understand what it's like, people will come back home once people have, they think their pay is fair. people think about fair pay. If I work for you and the type of worker I do, I expect to get fair pay where actually feel like I benefit. So
Right.
this is one of the things people are constantly complaining about. My daughter is in, well, she became a nurse 2 years ago. So I say, why don't you go Dominica and things? She's like, Mommy, really? I can't go Dominica. I say, why you cannot go Dominica? She said, you don't know how much my friend making in Dominican hour, Mommy. Like, because she went school in UVI in St. Croix, and then her friend went in school at Dominica State College. So her friend she left behind from school, she's in this as well. So they correspond. She's like, Mommy, you crazy. I can't go for a little amount of money. Not now I see taste the big money up in the States. I was like, okay, my daughter make more money than I make. And she's so young and she make more money than me. So I don't think she'll be coming down to make a little bit of money. So that's the reason, one of main reason the nurses go over, because once they qualify, they get good pay.
Exactly. That is why we have to offer that compensation package that can compete with them, to give our staff that reason to want to. Because let me tell you something, as Carlos said, nobody want to leave their country and go anywhere, but they
Okay.
go
True.
because they go for a reason. You're
So,
unable to support your family
mhm,
on the salary that you get in as a healthcare professional at home. You have children, you don't know how you're going to send them off to school in the future on that. You understand?
Yeah.
Although some persons say, some I've heard persons say that even though the pay is less in Dominica, there's a lot more that they can benefit because they can grow their own products, produce to eat. When you go to these places, you have to buy everything. Guys, a grafted mango in Angola is 5 US.
all right. So that is
So
what I
you
was.
understand what I mean?
One jelly is 5 US in US
Okay.
Virgin
A
Island. I refuse
bottle
to
of
drink jelly in US
I have
Virgin
to buy
Island.
a liter bottle of coconut water for $40 on
Me,
Anguilla.
yep, that's what I buy here, 40 US, and they put it in the bottle and you have to make do with it. I was like,
Okay.
nope, not happening. I wait
So
until I
it's
go Dominica to drink jelly water.
exactly. So
So
it's not
so
always
probably
better.
we may not be able to compete with the bigger countries in terms of price, exact price,
Hmm.
but we have to make the compensation package in terms of
Attractive.
yes. So it may not be the
A dollar
exact
to dollar value,
right,
but the
but
cost of
have
living will be good
we
for them, where they could come in, they could pay their bills, and they could still have money left over if they want to go on vacation, if they want to
Right.
eat
right.
out. So that is what we have to look into. And there are incentives we can give the nurses as well. We can give
Hmm.
them low interest loans, and so that they'll be able to build and develop generational wealth, because we
Exactly.
don't only want them to live and go, but we also want them to build generational wealth for their families to come after them. So the next person coming will be able to have a foundation, a
Hmm.
financial foundation that they can step on and say, hey, my mom started that, or my grandmother started that, and I could add to it and leave something for the next generation to come.
Hmm.
So it's a whole package we want to provide the people with, not
Right.
just monetary
Not
packages
just the
only.
money. Right.
So
We
we can
want to
also look at
upgrade
the.
our. Sorry, Carlos.
I was saying another thing we can do is to
Mhm.
partner with some of the medical schools.
Right.
So
Yeah.
if the nurse wants to be a doctor now, it's easy for them to just slide in to the curriculum of those medical schools, because our college is a degree program for the nurses. So and the credits will be sufficient for them to get into some of those medical schools.
Yeah.
That is something we
Yes.
can do. So putting together packages that would work for them, that's
Hmm.
something we should definitely look at, and I'm pretty certain that is part of our whole strategy moving forward. But for now, I don't want to go too much into it. But yes,
Good.
make it more attractive for our nurses. Not
Exactly. We
not if
know
you're
that.
sitting by the road,
Yeah.
by the road struggling for bus
I was about to say that.
to
I
get to
was
work
about to say that.
in the evening, and this after being on her feet for the entire day, sometimes on
12-hour shift.
a double shift,
Hmm.
Yes.
and that nurse has to struggle to take a bus to
In
leave
the night. In the
to,
night
to
sometimes.
China Friendship Hospital to go to
Hmm.
Portsmouth, for
Yep.
example.
Yeah.
In the night. Yeah. So
But
as you were
I
talking about
remember.
the scholarship, as you were speaking about the scholarship, if I lose that, we have already partnered with China, Cuba, these places there, and that has been ongoing for many years. They've offered scholarship to Dominicans for a while. So now we have to broaden that more, as Carlos was saying, and partner with other international medical institutions, and not just offer scholarship just for nurses to get into medicine, but they can advance training on different specialized areas.
Yeah.
You know, ICU, emergency nursing, anesthetic nursing, cardiac, different things. So that would be an incentive too. If I am in Dominica and I know that I can go to study somewhere to get to specialize in an area where I don't have to bear the cost of it, then that's another opportunity for them, because most persons, when they leave, that's the first thing they do. They start looking at ways to advance their
Yeah. The
professional.
professional work. Yeah.
Right.
And
So
also you want to make sure that when the person advance themselves, that when they come in, that you could pay
they have
them for their studies. Because it's one thing to go to study and come back and get the same pay as somebody else that did not do that. So you have to take all that into consideration as well. If the person go to study to specialize in whatever field or area, that when they come back, you should have a little incentive for them to, so that they could feel like their studies was not in vain.
yeah. One of the things that we've been hearing quite frequently within the healthcare services is overburden and feeling tired because of the nurse or doctor to patient ratio.
It's
Um,
very high.
Patient count is high and understaff, and staff working, as you Carla said, double shifts sometimes. So
Hmm.
we have to look at ways to prevent that overburden on our team. So we must equip our units with adequate staffing, or enough staffing, then, to have a balanced staff to patient ratio. That way, each staff gets better care. Imagine one nurse, or let's give and take two nurses and an aide on a medical ward with 35 patients. Tell me what quality of care you expect to get. And then you're hearing the
Exactly.
complaints all the time. Oh, my mother lied down there and she was wet and she this. But you have to understand, your mother, in as much as I can empathize with you, is one person out of the 30. And the nurses are sometimes
They stretch
overworked.
themselves out thinly.
Exactly. So if we can ensure that we have that right amount of staffing, because again, Dominica has a school where nurses are being trained, and that way they can you can reduce the burden of the work patient to staff ratio, which is like unequal, but they're not staying.
Yeah, that's the same
And they're
thing.
not
When
staying for
after
the
they
same
train,
reasons.
they're moving away because as
Exactly.
most of the thing for them is the pay. The pay is not sufficient to help them with the way they want to live it, because give or take, when you work 12 hours and after 5 years of working 12 hours a shift, and then you look at your pay and you look at your bank account, and it's just not you I mean to say, everybody thinking about themselves. So although we want people to think about the country, we also have to put things in place that the person can take care of themselves properly if we want
Right.
them to take care of the country. because you don't want an unhealthy nurse. One of the things you don't want is an unhealthy nurse to be looking after patients, or an angry nurse to look after patients, because trust me, you just imagine you as a normal person don't like to be angry, and just happen to have an angriness that feel she's underpaid, she's disrespected,
Overworked.
and then customers or clients are coming in and adding on that burden again. So you know what time it is.
Yeah,
I mean, I met nice nurses before. They are nurses. Listen, sometimes I ask them how you do it, because I have been in hospital several times because I have some children. So I've been. That's when I go to the hospital when I'm giving birth or things. I'm not really sick. Thank God for that. Um, but you meet some nice nurses, and despite pay and everything else, they still have that love and passion for the job, and they try not to make these things discourage them. But how long can one person keep up with that? After a while you get tired, because
exactly.
having 30 persons on a ward with you and one other nurse and two ward aid to help out, and you have they call you by there and they call you by here, it's crazy. It's really crazy.
Yeah. That's why you see a lot of complaints sometimes on social media, and I can empathize with the persons, but you have to understand, they too have to understand that the healthcare workers are human beings just like them. Some persons finish work at say 10 o'clock in the night, and they have to stand by the road to catch a bus. Scales was saying to go to Portsmouth, and they have to be back at work for 7 o'clock in the morning. You know the amount of sleep that person got?
Yeah, deprive of sleep. I know we really need to take care of the. I'm not saying everybody can afford a vehicle, but I'm saying if you have night nurses, you should put something in place, even if it's housing. Some nurses don't want housing, so if they opt out of it, then that cannot be your fault. It would be on them because they probably have other ways to get home. But you
Right.
should have these things available for them, readily available if needs be. That the nurse needs to sleep over because her next shift is starting early the next day, so she have somebody someplace comfortable to sleep, not shared space, because most people love their privacy. So you have to put it in a way where people still feel they have their privacy even if they're away from home, so that they can have a good rest to come attend to the patients, because you want a well rested nurse to come to attend to the patients, so to have that focus at work. You don't want the sleepiness giving you injection and watching the label and cannot read it. That would be chaos. So we need to think of all that, because nurses are really working hard, you know.
They are.
Nurses
They
are
are.
really
Our
working.
healthcare team, our healthcare professionals on a whole, they
Yeah.
overworked and underpaid. And
Yes.
one thing too is the supplies. The imagine telling a nurse who is in the bigger countries, even here, that they should come back to Dominica, and you're accustomed to a particular way of working where everything is available, everything is readily there. You want to put a simple thing that everybody might know, a urinary catheter, right? We might just grab a pack with everything in it. In Dominica, they still have to make a pack.
Oh,
You understand? So you have to go there to get the catheter, go there and get the gauze to do the dressing, the cleaning, and go and get the cleaning supply and pick. You understand? That alone
yeah.
can lead to frustration, where you cannot. We have to make sure that these things are in place before we tell people, "Hey, come back home."
Yeah,
You
definitely.
understand?
So
Because
we have
you
to create
make
the
it work.
environment.
Yes, we have to improve that as well. You know.
But I'm aware of that. I mean, I've had family members who had the simple procedures need to be done, and we had to look elsewhere to get that done. So yes, we have a nice building, but we have to look at ways of filling it up with the necessary equipment. Yes,
Equipment.
we have some nice equipment names that's being floated about. But the stuff that is being needed on a day-to-day basis, do we have it? And if we
Yeah,
don't,
And we
What are
also
we
have to
doing?
train the
What are we
persons
doing to
to.
source? Also, our nurses are working hard. The doctors are working hard, but they work under pressure. They,
Yeah.
so what are we doing to encourage them to take care of the equipment, which by the way I'm sure very expensive. Are they taking care of the equipment? Do they have the motivation to take care of the new hospital we just received? You understand? So it's a lot of moving parts that we have to consider and get the sector to the level that we need, because we need to take care of all people. Health is wealth.
And we
Health
need
is
to, we need to realize that having proper equipment in the um rural areas, like if you have Portsmouth, Marigot, Granby, it could literally save life. Imagine you coming in and you just need to do a blood test to figure out what is wrong with you. And then you have to go to Rosa to do that blood test. It might
what
take 3 days before you get the results pending. But you need to know what is happening now, because just knowing now for now could save your life or prevent something from happening to you. So I Portsmouth used to have the services before, but they don't have it anymore because they don't have the equipment. The equipment, I thought they kind of outdated, and they didn't get new equipments and so forth. So we have to look into all that as well, to make ensure, as Sister Chrissy say, that the small outlets are well equipped with normal things for especially labs. You should have labs should be able to be done in Portsmouth and in Marigot and in Granby. You should be able to do your labs there. You should be able to do, and if it's anything more specific that you need, yes, you might want to go Roseau. But if somebody come in the night with an issue and you want to figure out what's happening, you should be able to do labs there and get your results in 30 to 45 minutes.
you
I
shouldn't
mean,
have
it
an
happens in the
issue
States.
getting a broken hand fixed in places such as a health center. You shouldn't have to go and do surgery to repair a broken arm. I mean, if it's serious and a bone
Yes.
shattered, that kind of thing, you have to do some reconstruction or something. A man fall from a mango tree or a kenip tree, and
You
and,
should have
and
an X-ray machine in Portsmouth to figure that out. I mean, you don't have to send a patient to Roseau to get them pay. You should have an X-ray machine in. That's what Chrissy was saying. Like the places that serve
decentralized.
as the extension of the hospital should have these equipments in place, so that the people, something happened in Capuchin, you run down to Portsmouth. The nurse is not in Clifton. Yes, but it's a broken arm. They could just put you on a vehicle, send you down to Portsmouth. You could have the X-rayed right away. The doctor can come in. He could read the X-ray, tell you if it's something that requires surgery or if it's something that requires just putting a what they call it, Chrissy,
A
to keep
cast.
a cast in or keep your hands straight or whatever. We should have these things readily available to assist the people in Dominica. I mean,
Guys,
to
those
have
are
everything being going to
basic.
Roseau, that's
Those are
crazy.
basic things that are
Yeah,
needed in a hospital. You cannot call it the Portsmouth Hospital and they cannot run a simple test. Imagine a granny, or not even a granny, imagine your family member waking up in the middle of the night with a chest pain
I'm
and they
telling you.
cannot diagnose that in Portsmouth. You're going to put that person who probably had, maybe there's a clot somewhere, put them on an ambulance in that road and drive them to Roseau, God forbid. I don't know if they're going to make it safely to Roseau, because you understand what I mean? If
Mhm.
Exactly.
Portsmouth was equipped to do this simple test, I mean, it may sound simple. We're not trying to bash whatever, we're just trying to say
To
that
bring
there's a
awareness to the people,
need
like
for
we could do
upgrading.
things to save
Exactly.
lives. We could
To
actually improve on some things that can save lives.
guys, an X-ray machine. I mean, even the private hospitals now, you go and you get MRI, X-ray, blood test, everything, and a hospital in a second town that should be equipped with these things. I mean, guys, we need to open our eyes better than that. We're not again, we're not here to bash anybody. We're not calling down the government or anything. We're just saying that those are the things that, as a team will be implemented once we are in the position to make that happen. And we can only do that through the Dominican people. That's all.
That's right. That's exactly what we're saying. We and I also tell people say, oh, you are always speaking negative. You cannot fix a problem without first identifying the problem.
Exactly.
You have to believe there's a problem for you to get a solution. So if we never speak about the problem, we cannot get no solution because we have never come to, even in our personal life, therapists will tell you we cannot help anybody that have not said that what they're going through is a problem. If you tell somebody, hey, you smoking will kill you, smoking will do this, unless they realize that smoking is bad for the health, they won't do anything to fix anything because to them smoking is okay. It don't do them anything. Whereas somebody who acknowledge that, you know what, smoking is really not good for my lungs, they will do their best not to because they believe that it's not good for the lungs. So we have to be able to say what is happening in order for us to fix what needs to get done. So we're not bashing everybody,
Yeah,
and we just
no.
calling on the public to just open your eyes. If you think you everything that you have in your hospital is there, then what we're saying does not make sense. But if you can identify with us this evening and say yes, Portsmouth need to be better equipped, Marigot need to be better equipped, Granby need to be better equipped. If you can identify that with us, then we are on the same wavelength. What we want for
Exactly.
Dominica is a better Dominica. Because even if you have wealth, but you don't have health, you're not going to enjoy your life because then you're going to take all your wealth to pay for all these illnesses that are going to come your way. So that's why we're trying to encourage people. We tell you that health and wealth goes hand in hand. If you want to enjoy your wealth, you have to take care of your body, you have to take care of your mind, you have to take care of all parts of you to make you healthy.
Body, mind, and spirit.
That's
Exactly.
right. And
So,
go ahead.
so in terms of speaking, speaking positively on the health sector, I'm looking at steps that I'm happy to see in the direction of decentralizing the health care in Dominica. In
Yeah.
that perhaps buildings have been erected all over the island, and I think the Maho Health Center is being used for example. I know for example for sure it's being used, but health centers such as the Savanpai Health Center, it's a white elephant. It's sometimes they come to clean it to make sure it looks pretty and nice so they can do their grand opening, but it's not being used. There are nurses living right there in the village who would love to be working there, but
Exactly.
it's not being used. Do what is do we have the equipment? What where are we? I know the government has handed over all aspects of the health care to the national health hospitals authority. What what is being done to get that going? How can we get our health being placed on the forefront? How can we get these places to be properly staffed and equipped and operational so so God forbid another forklift falls on someone, they don't have to drive from Marigot to Roseau. We,
Exactly.
we're looking at extending the runway. God forbid something happens in Mary Hall, Douglas Charles, I say, with the one ambulance and one fire truck that's there that cannot take care if a house will burn if a plane is on the ground. You know, what are we doing to make sure that the Marigot Hospital is properly staffed, that it's not leaking? It's you understand? These are the things we have to focus on. We also need to look at promoting our endless opportunities in recreative health.
Yeah.
Max
Right.
Montano, every time he comes to Dominica, He will not go by screws.
Uh-huh.
He has to go by screws, and he'll
Me
talk
too.
about it. He will talk about it on his social media.
Mm-hmm.
I don't want to take over you ladies program.
No, 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 you're going well because I mean that by itself is physical activity there, the hike to
Listen,
these places.
Right. So the natural spas, we have to embrace them and promote them heavily,
exactly.
promote them internationally so people can. And Dominica is one of the few places that you can find that on earth.
Yes, yep.
And a lot of it too. We have the sulfur spring, we still have the waterfalls, we still have
Oh
the
yeah.
hiking trails. So we have a lot of natural things that we can do to stay healthy.
But
And so
you know what we have that everybody wants? Fresh, unpolluted air. And
tell me about it. And the
clean
water too.
water,
Did
fresh
you know
clean
that going
water.
up to Ben's area has that source? Um, I know during after Hurricane Maria, that's where I used to get my water. And let me tell you, Brother Carlos, the water is very, very, very clear. I left the water in a bucket for a year and not one muck that was in the water. I was taken aback. And it have a whole different taste from the one of the Wasco. Not that I say anything about the Wasco people, but I'm just saying the chlorinated water has nothing over our natural spring water.
Oh yeah.
And so we also want to encourage people, if you're in the area that have natural spring, try to make the best use of it. I know
Mm-hmm.
now having the pipe-borne water in our home make us lazy. But I'm just saying, sometimes we have to give up something if we want to be better, make our health, get better health for ourselves. And this is one of it, drinking our source water, natural spring water it was really good after Hurricane Maria. I really enjoyed drinking that water straight from the rock of the earth. So we encourage Dominicans to take full advantage of that because people in the world wish they had these resources.
Oh yeah.
Because sometimes
Trust
I
me.
tell my children all the
Trust
time,
me.
if it's in Dominica, I don't have the story there, you know. When it
Uh-huh.
hot, I can bathe in the river.
Thank you. That sometimes I'm so hot, right? And they say you should go in the sea, and I'm like, in the sea? No, I need a river.
I tell you.
So,
Yeah.
and I'm going to mention something that is right up your alley. Our food, the
Listen,
Dominica food.
listen. We should take advantage of eating close to the soil. Let me tell you, when I was in Dominica, if I had to redo my life, Carlos, with all the information I have now and the experience and traveling that I have done in my short space of time, I would tell you, if I could redo my life, I would, with all the information that I have, I would not move an inch from Dominica because I have come to realize that everything that a human being needs to become better is in Dominica. I sometimes I tell them if they sure the Eden wasn't right in Dominica and it drifted away from Africa because and we have everything that nature. People, you hear people in the world crying, oh, they want natural food. They so much of these things we can grow it at the in our backyard. In our backyard, we can grow these things. When I was staying in Woodford Hill, I threw some pumpkin seeds out
Oh,
the window.
those things will grow.
Listen, next thing I seen vine growing. I check, but what growing there? The pumpkin grow and it made some big pumpkins. I was like, I said, oh my God, George, that soil is very good. Just say, but Petra, I don't understand. You would follow you there. I say, so how comes the people, and I say nothing bad about wood follow people, take it easy. I say, how comes the wood follow people are not so, they should be rich because their soil is so rich. What are they waiting for? Why are they going to Portsmouth to buy? They should be bringing stuff to Portsmouth to sell. So you know what I went to do? I got some lettuce plants by the Chinese in 1 mile, and I got some cucumber seeds. I let Judge plant it for me, and I was on market on Saturday selling lettuce and cucumber. After I worked for whole week, Saturday morning early, I live in Woodford, 4 o'clock. Judge packing up the jeep for me, putting all my thing, and I going down with my little baby. Kian at the time was small baby in the car seat, and I driving down to Portsmouth, me alone to reach there before 6 o'clock to get a spot. And before 9 o'clock, Carlos, all my lettuce and cucumbers are natural, no artificial fertilizer.
No fertilizer.
No fertilizer. And people were happy with the taste. The taste was different. So I'm not saying that because I out there. I saying that because I experienced it myself, and that's why I want to encourage it to all people. Let us go back to the soil. If we want to live healthy, we have to go back to the soil. And if we want to enjoy our wealth, we have to eat healthy to enjoy our wealth and to stay strong, because we don't want our workforce to die at 40 years average. We want our workforce to live up to 80 and 90 years.
Like
Because we want, exactly. We want our workforce to live long so that they can give us a lot of service for their time on earth, and they can train the young people who's coming. So that way we don't have a gap between that knowledge, lack of knowledge. We have a gap. We will not have that gap because we have the older folks teaching the younger folks as time goes on. So people, that's all we encourage in Team Unity. We encourage you that we know we can do better. And we're not telling to you because we like to run our mouth. We're telling to you because we know it's true. What you need to do is decide what is it that you want for your next 5 years. How you want to live your next 5 years. If you want to live your next 5 years guessing of what will happen, or if you want to live your next 5 years working with a team that know what that can be done to give you that better life that you deserve so much in Dominica. The choice is yours. No pressure.
So
That's
with that, we have hit the 1 hour mark, my dear sisters, and we need not intrude too much on the people's time, but more than to encourage them to listen to more of Team Unity. And like the ticker says at the bottom of the screen, Team Unity is all engaging.
Oh, yeah.
No matter what you think your support is or may have been, we have no issues engaging with you and letting you know exactly what we want to do. The vision we have for Dominica, that which may be different than what others are currently offering to Dominicans right now.
Yeah.
Back in the background, I'm playing again the song of Mr. Ridge and Chubby, Anita. And we in the independent season, we're giving you a little bit of independence flavor. Next week we may be looking at another topic. We may be looking at tourism. We may be looking at some agriculture. But don't you fret. We will be having a lot of information to give you Dominicans in terms of the Team Unity's vision for the betterment of Dominica. I'd like to thank my two dear sisters who were with me today. My co-host, Sister Petro, and of course, Nurse Christine Dupuy. We look forward to engaging with you more as we continue bringing forth the information to Dominicans.
Definitely.
Exactly. And don't forget, people, don't forget to follow our page on Facebook and on YouTube. Don't forget to subscribe and share with your friends and family. If you find it interesting, share with others. Let us all be educated, because remember, knowledge is power. We want to give the power back to people. Health is wealth.
Exactly.
And we want to make sure our nation is wealthy. So we're calling on you to join us as we promote both power and wealth to our people of Dominica.
Thank you, folks, for tuning in. And we do invite you to tune in at the next time that we come with you, bring Team Unity's clean slate to you Dominicans.
Good night.
Good night, everybody.
There is nothing which is wrong with the country that a new government cannot fix. It is time for a new start, a fresh beginning, a new direction, people-centered leadership. That's why Team Unity Dominica introduces the Clean Slate, a new political direction for the current political era. The Clean Slate, an idea built on new and progressive energies based on what is best for Dominica and Dominicans. The Clean Slate, the platform for a new and progressive political coalition.